Good morning, everybody. I want to welcome everybody here and also online to the March 24th, 2020 special call meeting of the Board of Commissioners. Commissioner Cooper is with us by teleconference today. I'd like to just probably, of all days, just like to, those who are willing and able, please stand for a moment of silence and I'll lead us in the pledge of allegiance. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, thank you. All right, I've asked Dr. Memark and Dr. Brandstetter, I got that right? Okay, good. To talk to the board this morning about the health aspects of the COVID-19, what they're seeing and what their suggestions and ideas are to help us to shape what ultimately will probably be some form of a state of emergency that I may be signing sometime later tonight. So Dr. Memark, I'll let you go first.
Okay, great. Good morning, Commissioners. Thanks for having me here today. I'm going to talk a little bit about our county situation, and then I'll ask my colleague, Dr. Brandstetter, to give us a little bit of more information from his perspective as part of one of the largest health systems that we have down here. Okay, we're going to talk a little bit about COVID-19. Here are the updates that we have right now. Currently, there are over 40,000 cases in the United States. That number, the 800 cases in Georgia, was last night. This morning, we have over 1,000 cases in Georgia. 82 of these cases are in Cobb. That makes us the second highest burden in the state for COVID-19. Currently, we have 5 deaths in our county. One of those was made posthumously, and we actually have one that is pending a test result and has died waiting for that result as well. I'm going to talk to you a little bit about testing. That's probably one of the biggest questions that I get is about testing and why aren't we having testing. At this point, I don't know if it really matters why we don't have testing or not, because I'll show you why. In Georgia, the commercial labs, and we have seen an uptick in testing. So now we have had over 5,000 tests performed in the state of Georgia. The commercial labs have done over 3,800 tests, and 631 of them have been positive. The Georgia Public Health Laboratory has done over 1,200 tests, and 169 of those were positive. When you look nationwide, the test positivity rate is between 9 and 11%. In Georgia, we're looking between 13 and 16% that are positive. It has to do a lot with, we're testing our highest risk individuals, our first responders, and our healthcare workers, and so we do expect a little bit more positivity, but because we don't have widespread testing, you're going to see higher numbers there. We have limited availability, and I'm sure Dr. Brandstetter will support that hospitals do not have the testing capabilities that they would like. They have very limited testing to do what they need to do for their employees and patients. Our drive-through testing up to today has been able to do less than 30 tests a day. We have Georgia Public Health Lab that is able to do some testing for us, but because we don't have supplies, we can't even send tests there that way either. Even if you had all the tests that you wanted, the results are taking an inordinate amount of time. So we are getting tests between 3 days and over 7 days that we're not even getting results. So you can understand this is not helpful to our situation. We cannot make decisions if you can't get us a test result in less than, 12 hours, essentially. So testing is not the solution here. We can't make decisions based on whether testing is coming or not. Everybody's seen flattening the curve, probably one of the most famous diagrams right now. So to explain this, so when you look at the curve and you look at the big spike there that says without protective measures, if we let everything go, you're going to see a spike in cases. So why is that a problem? You see the dotted line there? That's our healthcare system capacity. If you shoot past that, then we cannot take care of the people that become ill. And we tried our best estimate to put that little star there of where we are. So we are on the upswing of cases, and we are just barely below our healthcare capacity at this time. If we put in measures and try our best to put in as best measures as we can flatten that curve. The reason why flattening the curve is important is you keep it below that healthcare capacity. So we can at least care for as many people that need it as possible. Why does it matter? We have no vaccines and we have no treatment. We have 2 hospitals in our county that are tertiary care centers, and they have less than 50 ventilators that are on hand to be able to take care of people. They have told us they can try to get some more, but you've seen the situation in New York. There might not be enough ventilators. We have over 760,000 people in our county alone, and this was a little bit of a surprise to me too. We have almost 6,000 nursing home, long-term care facility, and personal care home beds. That means we have 6,000 people that are in vulnerable situations that are in these homes. Why that's important? It only takes a little bit, an outbreak here or there, to overwhelm our health system. Some of these places have over 200 beds apiece. You've talked about why we don't really have testing capabilities, but I do have evidence for you, and it's very important. We have 3 daycares that have positive cases. I have 4 nursing homes that have either positive or pending cases. And those are considered outbreaks. Each one in a nursing home is considered an outbreak. I have multiple schools that have exposures. Thank God they let the schools out, and so that has minimized that a little bit. We have people in the hospital. Last I checked, we had over 60 people in one hospital that was under investigation or positive for COVID-19. So without tests, I'm telling you, we have community spread. We are not able to link all of our cases. Previously, I could tell you, that person came from Italy, this person had contact with a patient that was positive for COVID-19. I can't tell you that now. I can tell you that these cases are coming in randomly, and we don't know where they're coming from. Social distancing, we've heard a lot about that, and I appreciate that we've tried to do that the best we can here. Some people are heeding that, but it's not enough. I'm hearing reports of hundreds of people in parks, in bars and restaurants that are congregating together. The message is not getting out seriously enough. The only recommendation that I have at this time is for us to shelter in place. So we need everybody to take it seriously and not be spreading the virus. So we're talking that you only leave your homes for essential reasons and for essential personnel. So if we have things that we need for everyday life, to get food, to go to the hospital, and there's a nice list there. The governor has put in place some actions last night, and I think what we can do is support that. And just go as far as we need to. Because remember, we have the second highest, and we have a very dense population here in Cobb County. So I'm asking you to act now, and I'm going to ask that Dr. Brandstetter come and tell us what's going on his side, and we can answer questions afterwards.
Good morning. Thanks for allowing me to speak to you all. I don't want to cloud the picture or make it any less confusing, but 80% of people standing in this room will get COVID-19, no matter what action you take today. 80% of us will get COVID-19. Is it next week? Is it 6 months from now? The models tell us we're all a vulnerable population. 80% of us will get it. What we need to do is put in measures so our healthcare personnel can be available, the equipment, the supplies, the testing, medications, the ventilators can be available to take care of each and every one of us. The best measure for that to be instilled is social distancing. That's the only way we're going to be able to spread this out long enough. That way, when we begin, 80% of us get that we'll all receive the highest care possible that we want as healthcare professionals to give to each and every one of us. So why will 80% get it? Because we don't have natural immunity. What's 80% have to do with it? 80% is enough immunity within the community over time that it prevents its spread. It's the same concept goes for vaccinations. If we get high enough amounts of vaccination and protection within the community, then we'll stop the spread. That's why we push flu vaccines so much. What will social distancing get for us right now? It'll buy us time, more time to develop a potential vaccine, more time to get better supplies and more supplies in, but also preserve the amount of capacity in each one of our facilities. If we had another intervention that was simpler and less burdensome on our society, I'd be all for it. But right now, this is the best thing we can do immediately as we try to weigh our expertise to care for those who will get infected. And that's the driving point that I have beyond what Dr. Memark has already shared with you. I'd be happy to entertain any questions with Dr. Memark.
Well, that's certainly very sobering. So there's 4 of us here right now, so everyone's going to get it but me. Is that what I'm hearing?
You're more, you're,
Yeah, I know. I'm probably going to get it first since I'm the oldest.
you and me.
I think your responsibility, along with Dr. Memark, is to give us your best professional advice, okay? And her strong recommendation is shelter in place. Now, I don't want to put you in, you're not the CEO of Wellstar, so I'm not going to ask you that question, okay? So make sure that doesn't happen. But I think what we're hearing is that, first of all, be quite honest about it, that not enough people are really taking this seriously. Because not enough people that they know have been infected, and until they get that personal relationship with someone that has been infected, then they don't think it's that important. Is that a reasonable statement to make right now? All right. So we have to take measures to start making, to push the message that this is a virulent disease, and we got to start taking it seriously. And without making it about, without pushing to extreme of everyone's going to die, sometime. With this disease, that's just not the case, because we all know, if I heard correctly, that most people who get this virus will probably recover. Okay, but the part that's really fascinating to me, although it's kind of really worrisome, is that you can have the disease and not show the symptoms. Is that correct? So that more than anything mandates the social distancing until we can come up with some time period where we're not having an increasing number of cases. So what would be the indicator to you that we're finally getting our arms around this?
I think for us is if we can see a decrease in the cases. Right now, if you look at the models that are being showed, the rapidity, that how rapidly it's increasing is exponential at this point. So right now, we're just showing that it's spreading. If we can show that there's a slowing, and with more testing as this progresses, we might be able to show that a little bit. Or I watch the hospitals as well to see how many people are coming in and how serious it is when they're coming in. So that's what we have right now. We have to see if we can slow it down.
So Dr. Brandstetter, sure, go ahead.
Yeah, I think the biggest measure that we'll see, the hardest evidence, is how many people are hospitalized with this, if we can slow that down. So that is a number we track every day, Dr. Memark as well. But when we see that kind of flattening out and not shooting up exponentially is a good indicator that we've got control over it.
So if we did adopt the shelter in place, okay, that chart you had with the star and the graph and the flattening curve, how long would it take for those measures to be effective where you'd finally put that down to get it back on the chart where you want it to be?
It's a great question. The modeling that looks at that predict that we have to wait at least 2 weeks to see the full impact, because if someone has it or already been exposed, they may develop symptoms within the next 2 weeks window. So to see that kind of flattening out with no new cases or the rise in new cases slowing down, it'll take us at least 2 weeks to see that impact.
And you agree
Probably
with that, Dr.
longer.
Memark? Okay.
No, I agree with that. And then there are other models that are saying that, you might have to see it at 4 to 6 weeks, but at least 2 weeks to be able to have everybody shelter in place. But that's a minimum amount of time that you'll need. But you may not see it until, remember, if we shelter, then everybody, if you stay home, then we won't be spreading it. So if I shelter today, what result am I seeing right now from cases? It would be from 2 to 14 days previous, right? It takes average about 5 days to be showing symptoms. So if I shelter today, I'm seeing the past. Now, if I do shelter for 2 weeks, then you'll see the results the 2 weeks after that, right? Does that make
Gotcha,
sense?
sure, absolutely. Ms. Sherratt, you had a question?
I do. with this graph that we have here is really kind of, it's kind of mixing some things here. We talked about the number of people that are infected. Everything that we see in the news and what you showed us was the number of people infected and the number of people that have died. But the reality is what we're really concerned about is where are we with the healthcare capacity? Okay, so I think it would be useful for the board to see, and Dr. and yeah.
Don't feel bad.
Yeah, well, I mean, and we know we have basically the 5,900 beds. Or no, that was, well, we have an X number of beds. I think it's important to know how are we doing on that? Because, we could get a whole bunch of people infected and not impact the healthcare system. Because as we talked about, 80% of the people, 80% of the 80% are more than likely going to get a mild case and probably will never go into the hospital. And so I think what we're really trying to do is we're trying to manage those hospital beds, the people that are hospitalized. So I think it would be useful to know where are we with that? I mean, yes, obviously it's important to know how many people are infected and all that, but what I hear you saying is that the healthcare system capacity really is the hospital beds. Is that correct?
Yeah, but that's not 5,900.
No.
No,
That
I know.
was-
I mean, yeah, that's a different number,
Right.
but my point is that, yeah, I think that as we do more testing, we're obviously going to see more percentage of, or number of people that are infected because we're testing.
Right.
But I think that there's a whole bunch out there that are infected that we don't know about.
Yeah.
But really, what our concern needs to be is where are we percentage-wise with the hospital beds? Because that's the healthcare system we're talking about, right?
So Danny, Dr. Brandstetter could tell us more about the capacities for the hospitals, but they run pretty high most of the time, okay? The hospitals I've talked to yesterday had no ICU capacity at this time, okay? So when we talk about that 20% in social distancing, the important part here is not the 80%, right? When you look at that, yes, 80% are people, and I think people are finding that too reassuring, that I'll be okay. I'm one of the 80%. I don't have any medical problems. I am not an older person. I'm not on chemotherapy. I'll be fine, right? That reassurance is causing people to not take it seriously. Now, what we're trying to do is if we distance people, you are trying to keep that 20% to a smaller number.
Yeah, no, I get that,
right?
and I'm not saying that we don't need to do social
Yeah.
distancing and all that. I just, I want to make sure that, yes, we keep seeing the number of infections, the number of deaths, but what we're really trying to manage here by all these other measures is to keep the 20%, whatever the number is, below the curve,
Yes.
to try to not go exceed the hospital
And
capacity
we're
because
close
we
to the
know.
curve, We
Right.
can give you exact numbers. They change by the hour.
Right, but because, I mean, every place around the world that's had a problem, they've exceeded their capacity. Right.
So one piece of data that may help you get your mind around a little bit more, this doubles in about 4 days. So where we are today, we should see a doubling in 4 days. So if we see 1,000 cases today, in 4 days, we'll see 2,000. So it's, even if we're comfortable in cases or amount of capacity of hospitals today, in 4 days, it's easily that we're over capacity. Because it's a simple double.
Do you have a question? Commissioner Burrow.
And we're not at 50% of capacity. We're over 50% capacity.
Okay. Well, also, to keep people from going out that with no symptoms that could be carrying the virus, what are we seeing at the drive-throughs of people that are getting tested based on their doctor's recommendation or hospital or whatever?
What do you mean by what are we seeing?
The drive-up testing
Yeah.
that we're doing at Jim Miller Park?
Yeah,
Have we been supplied enough test counts to keep up with the number of people coming through there?
absolutely not.
Have
So-
we gotten results of the diagnosis from that?
Yeah, so the results are trickling in, and we have had some positives come through. We've had some very sick people come through too, and so we actually did have to send one to the emergency room. We are not doing districts are doing them a little differently, so I'm not opening it up and then having people all come together. And then what we do is we have a list that's been sent from the state, and we schedule only the ones that we have test kits for. So I'm not making people come out and stay there all day just to try to get a
Right.
test. And so, like I said, I, right now, have the capacity of less than 30 a day. That's the average that's been happening over there. And so we get
Okay.
provided those test kits, and then we test the highest risk that we can.
Saying you don't have enough test kits right now.
No, we
Okay,
don't.
that's nationwide.
That's, yeah, that's.
We all understand that. It's not
Different,
just-
it seems to be a local, I mean, a regional type of thing, so we just don't right now.
And just before, Dr. Brandstetter, could you tell us your position at Wellstar? Just,
Yeah, I'm an infectious disease specialist, and my system-wide role is the medical director of infection prevention and emergency
okay,
preparedness.
I think that's helpful. Commissioner Gamble, you have any questions? Commissioner Cupid?
I'm good, thank you.
Is she there?
Did you have any questions?
I'm good for right now, thank you.
Okay, just want to make sure you include it in the conversation. I had a train of thought here. Gotta loosen my tie. I think the point that you made earlier, Dr. Memark, is that it would only, your concern is, and I'm sure Dr. Branstad has the same one, is that we have roughly between 50 and 60,000 people in Cobb County that are over the age of 55. Okay? And the mortality rate for those at that age group who catch the disease is pretty significant. So even if you got 10% of those into the hospital, it would overwhelm the healthcare system. So we know we have a large population here, because we have an aging community here in the county, that I think they're taking the necessary precautions, but nonetheless, that's something that's a big concern to all of us. And then the other point you made is that it would only take one case of this virus in an assisted living, where the risk of it spreading would very quickly, and then that would also take you above the dotted line here on the chart. So I'm not sure how many of these facilities we have, but we have 6,000 beds roughly. So even if you had 10% of those, that's still 600 people. But that could overnight have to receive medical treatment. And the bottom line is, you just don't have the facilities to take care of that many people.
Mr. Chairman, kind of jumping on the senior issue here, and you and I talked about this morning. And I don't know, Janet, if this is a discussion from public health with the places like Costco and the food stores, but I went to Publix at 8 o'clock this morning, okay, which is when under or over the people that are not 65 can go. And I talked to the assistant manager from 7 to 8 at the Publix by my house. They ran out of carts. Okay, and that was the over 65 shoppers. For them to run out of carts was way too many people in that store. Now, I applaud Publix for having a special time for that population, but if you put that many in there, and so I think that, it's an essential need. And one of the things that the board of the county may need to do is to figure out a way with some of these. And I saw the same thing at Costco on Sunday. I went there as soon as they opened, and to their credit, they're limiting the number of people in there. But when I walked in, I felt fine. When I got ready to check out, there were way too many people there. Okay, and so I think that every place else you go, whether some of the things that are open that people are saying we should close, I don't see as much of a problem. Like some of the restaurants, you might see 1 or 2 tables in there, but some of these places that we're actually trying to help, where I think we're actually creating a bigger problem. Now, those people are not the ones in the homes like the chairman's talking about, and I think most of the assisted livings and all that have locked down. And so their food and everything is I think, coming from the management. But I do think that one of the things that we need to do is figure out a way, and I'm sure there's a grocers association or whatever, but I think it's great that they have special times for the seniors, but we've got to manage those numbers, because just that this morning, you could have populated, that whole population, and it's the same thing the chairman's talking about. So I think that a lot of the stuff that we have in place is working, but there are situations where we are actually creating something that is worse than it was before we had that.
Yes, there's some very good examples to our colleagues and our citizens out west in California who have systems in place that do address the issues like you're doing. Very much applaud you for pointing out some of our problems with the mass people at shopping areas. So I think there's some good examples out there that we can adopt or provide to help with those problems.
Yeah, because I can tell you that when I went at 8, there were less people in the store than there were probably the hour before. I mean, you could go up and down an aisle and there might be one other person in the aisle at 8 o'clock, but at 7 o'clock, I guarantee you that store was wall-to-wall people. And so we need to be careful. The reason I bring it up is, all these things that we talk about doing, we have to be careful because in some ways, we actually almost put people in the funnel. And so I think people need to understand that, we talk about social distancing and we talk about sheltering in place and some of these other things, but the avenues that we then leave open, and sometimes we're better to just tell people, hey, you need to social distance. You need to kind of stay in your house if you don't, unless you need to go out. But if we start, putting these times or these periods that you can do things, we're going to make it worse.
If I may interject also.
Sure, go ahead.
Yes, I think Commissioner Ott brings up a great point of how difficult it is to legislate social distancing with practices that we anticipate are helping the public could actually be challenging the scenario. And I'm at a loss. I wasn't necessarily bent toward a shelter-in-place policy initially, but over the past week, since our last meeting, this looks to be more and more of a reasonable idea, considering the rapid pace of infections and the limited care that has been observed in so many instances of people not socially distancing themselves. I cannot think of another remedy. I mean, even if we were to approach a grocery store association, there are other venues that could still facilitate people coming together in larger numbers or in close proximity. I'm open to ideas, but I just don't see how the things that we've put in place thus far are proving themselves to be effective in keeping people apart and in limiting large groups.
Yeah, and I think Dr. Memark would agree with you, was add along with Dr. Brandstatter, that we've done our best to try and have informal enforcement of these social distancing. And as we saw this weekend, it's simply not working. As I was telling somebody this morning, the one weekend where since January it has not rained, we had the best weather ever, and everybody went out to the parks. And I think that must have just really caused everybody in the healthcare community to give serious pause, like, we need to be doing more. So I applaud Commissioner Cupid. This is a tough call, but I think in the health desk care of case of healthcare, and to flatten the curve, we got to give serious consideration to something like a shelter in place.
That's exactly.
Well, but at the same time, Mr. Chairman, I think that, and the two examples that I gave, we talked about limiting
Right.
time. Okay, if you narrow down that window, you're going to force more people together. Whereas if you have a wider time frame, okay, because every grocery store, and I applaud them because they're closing earlier to give the time to restock and to clean everything. And on the public's credit, they have a person whose sole job is to sanitize carts. Okay, but if we limit time, we force more people, and so we have to be really careful, especially on these essential businesses, which are many of the things that we have, because the reality is with online shopping and everything else, if you're not an essential business, you're not in a brick and mortar store. So I think we have to be really careful. And because I noticed, I was in a restaurant last Friday and there were 2 tables that had people in them, ours and one other. okay? And the other table was clear across the room. So we talked about closing bars and restaurants, which I don't have a problem with, and as long as people understand that if we do close bars and restaurants and allow takeout only, you got to take out, because otherwise they're not going to reopen. But the fact of the matter is, here we have a situation where you have something you want to close, and they're doing social distancing, and nobody's in the restaurant. I mean, all you got to do is go look at the airplane when I go fly. I mean, you know, I can fly an airplane and there'll be 50 people on that airplane. So people are social distancing or not doing things. But on the essential services, when we narrow down the window, we get a situation like happened this morning in the Publix, where you overload the system. And so I think Commissioner Cupid, you know, I agree with her, and it's what I said. We have to be really careful about, you know, people are going to do what we tell them until it stops making sense. And when all those people that went shopping this morning, they have got to be wondering, why am I here with all these people? And so I think that the bigger window that we can give people to do the things they need to do, the less people we're going to have doing it at one time. But if we narrow it down, they're all going to be there because they have to do it.
Well, I think, but in the bottom line, and it's the virus that's going to be the deciding factor. Because as I was telling somebody this morning, they were talking about this very important thing about trying to keep the lifeblood of the county. In the end, if none of these measures are followed to the letter, then the virus will win. All right, and you don't have to worry about business staying open. There'll be nobody in business to keep it open because they're all going to be homesick. And I think that's the point that has to be struck home here, is that the virus more than ever is driving it right now. Nothing we're doing right now seems to be, well, it could be much worse if we hadn't done some of the stuff we'd already done. But nonetheless, it's not enough to flatten the curve. And I think it's just one of those hard things, because I understand that this is unknown territory for all of us, because none of us up here are economists, all right? We want to do what's best for the public, but we're going to have to make a really hard call here. But I think it's best that at least we all understand what's at stake as to why we made the decisions that we did. So I appreciate both your time this morning. I understand also that this afternoon Wellstar is having a conference call with all the mayors and other people in the community, including Dr. Memark, to further provide information about the status of what's going on at Wellstar. So I thank you both for coming this morning. Do you have any other comments, or anybody else from the board, any other questions of them? Okay, thank you very much again for coming, all that you do. Okay, so I'll go around the table here. I'll start with Commissioner Gambrill.
Thank you, Chairman. And before we start discussing this internal draft, I would like to ask the county attorney to fill us in on roles, responsibilities, and such during this time. Because I know I've personally been a little confused over the last 2 weeks as far as what my role is. And then given the information, Chairman, that you've sent out, for example, parks, according to the document you sent out on Sunday, that was supposed to be a decision of the board, yet yesterday it was decided to close the parks, but the board hadn't made that decision. So if I could ask you to clarify what each individual's role is going forward in this matter, I would appreciate it.
You might want to try the dais.
Commissioner, I mean, your current role right now hasn't changed any at all, because we're not under a declaration of emergency. At the same time, the county manager is the chief executive officer of the county, and he's able to make the decision regarding closing the parks if that's what he believes is the appropriate thing for him to do, just like what he announced before during the limited operation services. Now, if we go into a declaration of emergency, which would be what potentially the chairman's thinking about doing, then it would be according to whatever the code sets out and what the specific declaration of emergency would give him that power to do. After a declaration of emergency is issued, the board would have the right to be able to remove the declaration of emergency by a matter of a resolution at a meeting. So.
And then what is the role of, say, the CEMA during this time and our other departments as well? Who essentially is going to be making the decisions going forward once the board declares this emergency?
Well, the chief executive officer, the county manager, would still be making the decisions. Any policy decisions that would need to come forward would come directly from the chairman pursuant to the declaration of emergency. The CMA is then authorized under the declaration of emergency then to be able to engage with FEMA, engage with GEMA, and set up any particular directives or any laws that they would need to be able to follow through with in an emergency. It kind of streamlines that process and allows it to be able to be connected more seamlessly.
You still have the floor.
I'm good at this time, or are we going to start discussing
Yeah, in a
the
second,
draft
but-
that you put before us?
Yeah, but you might want to also, explain what the county ordinance says about this, who can declare the state of emergency and why the reasons for it.
Well, the county ordinance, like a lot of them, it's basically a model that's used throughout the state that is left in the hands of the chairman to be able to issue the declaration of emergency. I mean, the reason that is because there's an emergency that's ongoing, and you have to be able to consolidate that power in order to be able to make those decisions at that time. So that's why it's done. I think what the chairman is asked to do is he's asked us to put together a draft of what that might look like. We've done that over the last few days, and then I assume he's seeking input from y'all for him to make a decision about what he wants to ultimately include in that declaration of emergency.
Yeah, couldn't have said it better. Thank you.
Right, and in doing so, I guess where a little bit of my confusion still is while we declare it, Cassie and Randy, sorry, I'm not saying your titles right now, but, we've got great staff that has been through this back in 2009 when we had the flooding. So essentially, are they the ones handling and calling the shots per se going forward, or is it going to be the chairman? What is the role of the different agencies in determining what's the best step to go forward with?
Well, the CMA director is able to work with FEMA and work with GEMA, excuse me, in order for them to be able to operate in the emergency if they needed additional beds, if they needed to be, for people to be able to quarantine a specific area, that gives them the authority to do that. General operations of the county would still be, it would come from the policy direction that the chairman would set based upon the declaration of emergency, and then the chief executive officer of the county manager would still be able to act as he or she normally would.
Commissioner Burrow.
But as far as, pardon?
No, you're
As
good.
far as the, or were you done? As far as the incident command operation that's in place now, based on the national standards that we're working with staff and everything, what does that do? Who authorizes that, or where does staff play into that as far as then if an emergency is declared and the chairman makes the call?
When the chairman makes the call at that point in time, Randy might be able to speak to specifically at that point in time how that operation would then kick in. So,
Randy?
That NIM structure is a way that we can clearly define how communications and responsibilities are distributed so that we can maintain our span of control, if you will. NIM says that 3 to 7 is the most that we can manage, with 5 being the optimum. And so that structure is designed so that we can manage our span of control, and all of the information flows up through that command chart to the person who ultimately makes that decision. That's the incident commander, if you will. And so that was put in place so that we could clearly identify the path of communication so that we can address. I can't oversee everything going on. That's why we made you the liaison to certain other areas that need attention. And so it gives us the ability to manage that span of control. And let me say, the word liaison in the incident command structure let me say that that's different than your liaison to the departments within the county. Those two have no connection to each other. And so in the incident command structure is designed so that we can manage a span of control and that all the information flows up and down that chain of command so that the ultimate decision is made by the incident commander. Now, is the chairman seeking input and recommendations from the SEMA director and myself? Sure we have. We've communicated through those things and also through the county manager's office. And so that incident command structure is designed and put in place so that we can manage what's going on, and there's a clear delineation of how communication travels up and down that command chart, if you will.
So that would still be in place?
Yes. Otherwise, we have no structure.
Right.
There's got to be a structure in place for us to work through what we're dealing with, and that's why that's been put in place.
Okay.
Yes, ma'am.
Can I ask who the incident commander is? And then also, can I get a flow chart so I can see
Sure.
how the NIMS is set up?
Sure. There's your hard copy. I will email that to you all as well. But right now, and
With
we.
my list. I
Okay.
emailed it to all the commissioners with my list.
Okay.
Okay, so where my confusion is, Commissioner Burrell, is I thought this was a flow chart that you set up for the communications group that you were in charge of. I didn't realize that this was
That's the whole,
Yeah.
the NIMS.
Yes.
that's all,
Yeah.
everybody.
Okay.
You got Jackie and Rob with, over the cities, liaison to the cities. I have the community, community liaison, community input, broken down to healthcare businesses, you know, so on and so forth, and citizens. And then you have an officer up at the top, you have Ross Cabot as communications, and so on and so forth.
And if we were to complete that organizational chart, it would continue on and on and on. I gave that to you for the brevity of the structure.
So, but according to this chart, the chairman is an incident commander.
Yes, and obviously, there are typically, in the incident command structure, there are operational periods of 12 hours. But with the situation that we're dealing with something different than we would let me say this correctly because I don't want you to misinterpret what I'm saying. It's very difficult with what we're dealing with right now to make that square peg fit into that round hole because we're dealing with something totally different than an incident that's over a 2 or 3 day period. And so we've got to look in the long haul of this. There obviously has to be some decisions made that on the fly. I'll give you an example. There's an opportunity right now where we can purchase 1,000 N95 masks to share the expense with our neighbors, our cities. And I think that you're looking at a $97,000 purchase. And in this case, I think that would give the county manager the authority to purchase those things rather than come through you guys and through the incident commander to do that type of, make those type of decisions. And so a lot of things that we're dealing with, we do have time to have those discussions. But in some cases, when these opportunities present themselves and knowing that supplies are very limited, that's something that I think the county manager has to have the authority to say, hey, we need to do this and do it quickly. And so, so we are dealing with a very unusual incident, if we want to call it that, than what your typical 3-day snow event or tornado or something to that nature. So we're just trying to manage our communication up and down so that people are made aware and putting the situational operation reports out there to the public and also trying to send a more detailed version to you guys so that you know what's going on in each department. And then if the public don't get their answers from those links on the county website, they have that number, that emergency number that they can call, which we are staffing right now. So I think we got things going in a really good direction if we can just get people to do the social distancing.
So in 2009, when we had to activate this for the flood, and I know the flood is totally different
Sure.
to what we're dealing with now,
Sure.
was the chairman the incident commander at that time as well, or who was in that role?
Let me jump in. I was here.
Thank you.
Okay. Basically the county manager ran operations, and when we get to be my turn for the comments, I think that one of the things we need to understand here is that Randy, Cassie, Dr. Memark, all our staff, they are the experts, okay? We are the policymakers. At some point in time, we have got to let them do their job. We can sit here and ask all the questions we want, but if you're on my airplane, you're the last person I want to be telling me what to do in the cockpit, okay? And that is what we're trying to do here. You know, Dr. Memark and the folks from Wellstar, and I'm sorry, doctor, I'm going to get it right before the day's over. We heard what his specialty is, okay? That's what they do, all right? The code is set up a certain way, whether we like it or not. That's what's in place now. And yes, it does give the chairman authorities. You know, we've all seen the initial draft that the chairman sent out, okay? It is not necessarily overreaching. But at some point in time, we have to let staff do their job without us telling them every little thing to do. And the incident commander, they're going to be the one that oversees what happens. Because the fact of the matter is, and Rob and I went to a briefing at ACCG last year, just so happened that we went to the one that talked about emergency declarations, okay? And the fact of the matter is, the main thing that a declaration does is it gives Cassie control of almost everything. Because when you put in the emergency operation plan, she is in charge. And they emphasized that at the briefing, that that's what's supposed to happen, because that is what she's there for. And so I think we have to be really careful about worrying about flow charts and who's in what box and everything else. These folks, our staff, has spent an incredible amount of time. I mean, just last night, we had an outage that our IS and our property management folks were here pretty much all night, making it so that the online services would work for the citizens of this county. We have to let staff do their job.
And I totally agree with you. I just want to make sure we have staff in place to do their job and not
That is
the
what
board
Randy's
here.
job is, as the interim public safety director, is to ensure that, and he is here to tell us, they have spent weeks putting this together, okay? It is in place. We have to let them do their job.
Okay, Commissioner Cupid, I'm sorry, Commissioner Burrow?
That's what I was asking, that the incident command operation would stay in place regardless of declaring a state of emergency, and we're all working together on this.
Sure, and by, again, I want to say that we really are trying to make every attempt possible to get every piece of information that we can out to the public and to you all, so that we can continue our operation and you all be updated daily on how operations are changing. And that would also enable you to answer some of your constituents who may have questions, because I don't want to say this disrespectful. I can't take my time to answer emails to a constituent wanting to know how many of our people are being paid and how many are not being paid.
Okay, one of the things, just to kind of jump in on that, and I talked to Rob about this yesterday, and Ross. We actually found out about a chat service that would allow, basically, chats can handle up to 6 chats versus 1 email or phone call. And so we are actually looking into a system that would free up your folks to be able to have a chat with somebody that's looking for information, and it's very inexpensive. And so, because we know that that's an issue. So, like I said, I sent it to Ross and Rob yesterday, and they're looking into it right now.
I want to bring Commissioner Cupid into this conversation. Do you have any thoughts, Commissioner Cupid?
Yes, and just for the public who's watching, I did choose to stay at home again after watching reports about the spread of this disease and learning about social distancing and how it's still creating transmission. Out of abundance of caution, and to set an example, I chose to stay home. I was hoping I would be on video conference, but on teleconference today. I must share that I'm extremely concerned about the health and safety of our community. I think that there is an overwhelming desire from our constituents to put their health first at this time and to limit exposure. And from listening to the experts, as Commissioner Ott is referring to our staff to today, they provided, or Dr. Memar provided, that the best path forward would be for people to shelter in place, and this is what I've seen repeated over and over again by listening to various health experts, is that they are recommending for people to shelter in place to limit the spread. And we have the capability of limiting the spread, but trying to come up with every caveat to allow people to congregate, to tell people that they can socially distance themselves, to tell stores that, you know, these are certain things you must do for this industry, that's what you must do for that industry. All of this is doing is nibbling away at a larger problem that could be resolved if people were to shelter in place. I've received communication from various businesses that even understand that this is how the county could be moving forward. I think what they're looking for is some guidance on knowing that if they have an essential service or if they're distributing goods, could they still continue to do that to remain viable? There's some businesses that are looking to see what we can do with respect to waiving any penalties of interest or delaying payment of certain fees or deferring it at this time so that they can be able to remain viable. Some of them are looking to us to see if there's any support that we could be communicating for their employees at this time while they're not at work. I think people are getting the severity of this, but we have the ability as elected officials to make decisions that reflect that. And to be honest, I'm just concerned anything short of a shelter in place with different provisions for maintaining essential services is going to result in us prolonging the impact of this disease here within our county. It's going to facilitate people who don't display any symptoms. It's going to facilitate them spreading this to others. We are just going to be a conduit unless we put some very hard measures in place. And that's what I'm looking for from our discussion. And one question that I will pose to every commissioner: if the evidence has not indicated that that's a step we need to be making or taking, what evidence will? What do you need to see? Do we need to see somebody with our staff contracted? Do we need to see our next door neighbor contract this disease? Do the numbers need to be any higher? Last night I was listening to the director of health for the World Health Organization, and he provided that when the first incidence of this occurred, it took 57 days for 100,000 people to contract it. The next 100,000 took 11 days. The next 100,000 took 4 days. I just, with the exponential growth of transmission, I do not understand what it's going to take for us to really put in effective measures to keep this rate of transmission from growing as rapidly as it has been. Cobb County, we are one of the most populous counties within the state of Georgia. So I think, people are saying we should lean on the governor and do what the governor is suggesting. But the governor, he has 159 counties of various population and density. But we have one of the top densest communities or counties within the entire state of Georgia. What are we going to do? I think it is not for us to follow the governor. It's for us to lead as one of the most populous and one of the most educated counties within the state of Georgia. It's up to us to set an example for our community. And I'm not hearing us move this conversation towards that. I know that I appreciate Kelly or Commissioner Gambro's concerns because I think there just should be greater discussion with all commissioners as we're making decisions. And I've been disheartened to see that not happening at this time. But I understand our need to respond in an emergency. But with technology today, we all have texts, we all have different means of communicating. I think there is opportunity for us to all be in the loop when we're making significant decisions. But and I don't want that to belabor our decision on what we're going to do with respect to safeguarding the health of the public. And so my ask today is, I like the policy that I've seen, but it still comes very short as far as sheltering in place. It leaves a lot of the onus on our populations to do that for themselves, our businesses to do that, which has been communicated to be over and over again as woefully inadequate. So my ask again to the board after everything that I've shared is, what evidence do we need to put forward a shelter-in-place policy?
Okay, all right. Well, I agree with a lot of things you're saying, Commissioner Cupid, and I can assure you that, for one thing, we're having this meeting here so we can hear input from the commissioners. Secondly, things are moving very fast, and I think that we're all trying. We realize that today is the make or break day. Commissioner Dr. Memark's made it very clear, as other people, that we have to make a call today, and it has to be one that if we don't make it that's aggressive enough, then we will fail the public. And unfortunately, as much as I would like to have a vote on this, I'm the one that has to make the state of emergency declaration, but I'm gonna make it based on what I'm hearing from the commissioners and also members of the community and reaching out to them. And this is not an easy call, because no matter how right the decision is, we are going to impact adversely on the lives of people one way or another. And that's not an easy call to make, but it's one that has to be made. I appreciate that.
Yes, Chairman, and again, in piggybacking off your comments, again, Dr. Memark's recommendation is to shelter in place,
Right,
and leave homes only for essential reasons and essential personnel.
right. Okay, well, I hear you. Trust me, I do. The microphone's working very clear, very perfectly in this room, so everything you said here came out loud and clear, Commissioner. Commissioner Ott, you have some comments?
Yes, Dr. Memark, could you come back up? There was something I thought of after you sat down. So, we see a lot of people walking around with masks, and I don't know how many times we have to tell them that the mask does not do anything except take the mask away from the healthcare people that need it. Right?
Yes, sir.
Right. So, these masks, unless you have the virus, the mask does not do anything to protect you from getting it. The other thing, and I think I'm starting to see more of this, is people wearing gloves.
Yes.
Now, for people in the food industry and people that are giving you something, they are not touching other people's hands, and the gloves are keeping them from infecting you.
Yes.
You wearing gloves, if you're touching someone else, it doesn't matter whether you have gloves on or not. It doesn't change anything, because if you go around and shake people's hands because you have a glove on, you're still going to have the same things on that glove that you would have had on your hand, correct?
Yes. So I'm glad you brought those up. So we are having shortages of personal protective equipment, and that's within the hospitals as well. So our healthcare workers are not getting enough of those. And so unless you were ill, and not just with COVID-19, but anything right now with a respiratory disease, then if you have a mask to wear, then I think it's fine. I'm glad you brought up gloves, because it's giving people a false sense of security. If you are keeping those gloves on and then you are touching everything, you're making it actually worse, right? Because you're not washing your hands and you're spreading it. So if I shake hands with you and then I'm wearing my glove and I shake hands with you, well, now I've given what you have to you, and then I keep going around the room. So it's really, you're right, it's something
Yeah,
that
it doesn't matter whether you have gloves on or not.
No, it absolutely doesn't. You
you
gotta wash your hands. Everybody has to wash their hands.
Right.
And
Okay.
stay home.
Thanks. All right, so, Mr. Chairman, just,
Wait, don't go anywhere.
Do you have a question real quick?
Go ahead.
Instead of saying social distancing, can we say physical distancing?
You can call it whatever you want, as long as people stay home and don't gather together, and, you know. We do want people to stay social. I understand it's kind of a, you know, misnomer, no, not misnomer, but it's making people feel like they shouldn't be social. And you can do all kinds of things now online, and you can, you know, work, you can talk to your family. I've even heard online you can date without even having to go meet the person. So, yeah, if we want to call.
Well, that would be virtual distancing.
Oh, virtual distancing, but yeah. No, I understand. It does make it sound like we're isolating ourselves socially, and there's some issues that come with that as well, right? So we do want to make sure that we are trying to stay social but apart, so.
Yeah. I just think the physical 6 feet, physical distance is, I mean, applies to everybody, not just in social settings.
Absolutely, absolutely.
All right, Mr. Chairman, some other things.
Thank you, Dr. Mumar.
I want to thank everybody that's watching, because there's a ton of people watching, because I'm getting a ton of text messages. And I actually got something from a lady with the Grocer Association, so there is indeed one.
Aha, we found them.
Oh, she found us, trust me. She gave me her number. So
Good.
she said that there's, she gave me a number to call and talk to her about it. And she said, one of her quote right here says, many of the things people are doing are backfiring, causing worse crowds. So they were going to work with us on that. But, you know, as for the social distancing, I mean, if we do a complete shelter in place and we shut businesses down, those people that are there now, that are trying, these small businesses that are trying to practice the 6 feet and trying to keep people employed, if they shut down and these people lose their job, now those people are going to be at home. And so we already know that the nonprofits are struggling as it is. And so it is a balancing act, okay? And Mr. Chairman, you and I talked earlier, government cannot do everything. There are things that we can do. We can close all the government facilities. The county has closed the parks. We closed the libraries. We closed the rec centers. We've canceled all the special events. But at some point in time, people have to take personal responsibility. We can tell them. We can show them what Dr. Memark and what other healthcare people are saying. We can talk about whether it be physical distance, social distance, whatever you want to call it. It doesn't matter. We can tell people these things. But the fact of the matter is, a shelter in place with a county of 760,000 people is not enforceable. We cannot go to every single house. We cannot go to every single place in the county and tell people to go home. It just doesn't work that way. So I think what's more important is that we look at those things, and I talked a little bit earlier about these essential services. Yes, they are essential. Now, most of the things, that are on the list, like, for example, dry cleaning, trash, and all those things, those do not involve large groups of people. I think that special emphasis or taking a closer look at those things that have the potential to have a lot of people in one place. So grocery stores, Costco, pharmacies, Home Depot, places like that. It may be that we have to talk to them individually or as a group and say, hey, you have to help us here. Because the fact of the matter is, I would be willing to bet a large percentage of the county is practicing what we're talking about until they have to go do an essential service. And so what we need to do is what we can do as the government is set it up so that when people do those essential things that we know they have to do, that they can do it in a safe and healthy way. But to tell people that, yes, everybody should stay home. I think this is the first time I've been out in a week. And so I think a lot of people are doing that. But we have to take a look at these essential services and figure out a way, because that will get us above the dash line just as quick as other people roaming around the streets. But I just think that, we have to emphasize that people are going to have to start taking personal responsibility, because the government can only do so many things and should only do so many things.
And we can't enforce that either, personal responsibility.
Okay, so I'll be looking for more input from the commissioners by email, and I'll be drafting the order this afternoon, and then I'll run it by everybody here before it goes out. So thank you for your time today. If you want to, but.
Yeah, please.
All right. That's fine.
So
You could, look, if you want to do it, I'm fine to sit here and, take
Mr.
notes.
Chairman, I would prefer that we do it by email. I don't think we're going to accomplish a
Well,
lot sitting here.
But I'm not going to, look, you know me by now. If a commission wants to say something, I'm going to let them, have the floor, so.
Okay, well, I want to clarify a few more things.
Sure.
I'm okay discussing this via email, but in saying so, it goes back to the policy, because once we declare this emergency, the chairman can make the policy. But if you're going to put out a policy, are you going to at least advise the board that you will be putting forth a policy so that we know about it before you put it out and not reading it on social media or in the newspaper?
Well, I made a very clear commitment that there are no surprises. You don't learn anything from social media or the email.
Yeah, but at the same time, Mr. Chairman, I think.
But I have to be able to make emergency decisions.
Exactly.
All right.
There are maybe times that something, do you want the call at 2 o'clock in the morning? There may be something that the chairman has to do, and this is what we found with the floods. Okay? Natural disasters and crises don't work on the clock from 9 to 5. Okay, so I hear what you're saying, but at the same time, Cassie and staff have to be able to make decisions. I mean, I found out this morning about the issue that IS and property management had to deal with. I appreciate the fact that Sharon didn't call me last night, but the fact of the matter is, things don't happen from 9 to 5.
And I understand that. I know when you start saying policies are going to be put in place, I get a little concerned. And then my last question, going back to this chart for the NIMS, the incident commander, shouldn't that be the county manager instead of the chairman? Because it's almost as if
Actually-
if the chairman's going to be.
The incident commander is actually Cassie. The chart's wrong, all right? Cassie's the incident commander.
Right.
You have to understand that it's
Okay.
not, we're trying to correlate the overall charge of the county with the person responsible for handling the exit emergency. That's the person that's making the call, all right? So that's Cassie, that's why we hired her, she's got the experience, and we're gonna change the charge to reflect. I will not be making the day-to-day calls for what to do, what has to be done here during this emergency to respond to the emergencies. That's the responsibility of the EOC, and the EOC is headed by Cassie, and that's who's gonna be making the calls.
And I think the other thing, Mr. Chairman, that's important to, you don't make changes in the plan when you're trying to use the plan, okay? If there are things that might need to be changed in the policy, now is not the time to do it, okay? This has been put in place with the help of ACCG, NIMS, and all these other agencies. This is why it's in place. It is being stood up. Now is not the time to go, oh, well, we should do it this way, okay? We are in the middle of a crisis. You don't change how you do it, all right? You take notes, and it's called an after-action report, okay? I understand that, there may be some things that all of us may not be comfortable with the way the code is written or whatever, but I think that, we've made it very clear today that Cassie, if the chairman does indeed declare an emergency like he's saying he's going to, Cassie becomes in charge of most things. The chairman is given the ability to do certain things, but in his declaration that we've seen, most of that is given to the county manager. A lot of the things that are in that draft that are given to the county manager in the code say that the chairman can do it. He is giving it to the county manager, which I agree is where it should be. But the incident commander is Cassie, and that is what Rob and I heard last year, that it is sometimes difficult for boards or city councils to understand that when you declare an emergency, that is the person in charge. That is what she's trained to do. That's what we hired her to do. And she has gone to numerous conferences to do it. We have to let her do her job.
The other part also is, doesn't give me the authority to overturn policies. It would have to state that in the state declaration of emergency, but no policies changed as a result of this emergency declaration. I don't have the authority to change any policy that the board has already voted on. So if that's a concern, this declaration does not allow me to do that. All right?
And Chairman, let me say, the declaration is the game changer for the shift in that incident commander.
Right, exactly. They're now running the day-to-day stuff, so.
Right, and as I started my questioning with the county attorney, I just wanted clarification, because again, I've read our policy, I've read our code and what is in place, and I'm glad to see we're going to be following it, because sometimes to me it appeared we weren't. So now I have reaffirmation that, of how it's going to go, how staff is going to act. Cassie, again, thank you for all you're doing, Randy. Rob and Jackie and everyone else that is here, I appreciate it, but I just need a clarification, because again, I've read what the code says, but I wasn't necessarily seeing that followed, so thank you.
Yeah, that's a valid point, Commissioner Gamble. I appreciate that. You know, the uniqueness of this emergency that has changed, I don't think, we had the flood, it happened overnight. This is evolving, and we've been trying to respond to it in a way that, you know, allows us to maintain the life we always had. Ladies and gentlemen, that life is over for a while. And that's what has to be acknowledged. So I get what you're saying, and we're gonna do a much better job of communicating to the commissioners. I was just trying to maintain a certain status, and after a while, I was defeated. It's just not gonna happen, all right? So we have to, with this new EOC stand-up, we now have the structure in place to keep everybody informed every single day, if not every hour, of what we're doing, and there'll be no more of that, what's going on here. But that's a valid point, and I acknowledge it, and this will take care of that.
Chairman Boyce?
Sure, Commissioner Cupid.
Yes. I don't know if we're trying to wrap the meeting up shortly, but my thought is that we review the policy so that the public is aware of what some of these considerations are. I'm not sure if this was put on the screen. I'm not there to see. It is quite extensive, and I know this falls within your purview to make a decision on it, but I don't think it hurts to at least have discussion on some of these clauses before we all get off the phone and then play wait and see to see what's
Go ahead.
occurring.
I'm fine with that. You can go ahead and make your comments now.
Okay,
We'll talk
because
about it.
there might be some things in here that you have consensus upon, on. And so maybe it may be helpful to see
Like, for instance,
which
we're not
clauses.
going to implement a curfew, Commissioner Cupid. That's in the draft. We're not going to implement a curfew, all right? It's absolutely
Okay.
unenforceable.
Okay, but even going back to the policy after the whereas, I don't know if was put on the screen what the different measures are that we will be implementing through this policy.
No, that has not been put on the screen, Commissioner Cupid. We have not. If you want us to put that on the screen, we can do that.
Yeah, just for sake of transparency, again, so they don't just see it published, I just think it's important for us to talk through it. And I don't know if everyone has a copy of it in front of them.
Give us a second here while we run down a hard copy, okay?
I have a clean hard copy.
Okay, we got it here. So we'll
Okay, is it possible for us to put this on the screen to see what's proposed? Or this is just internal? I see this is internal.
Well, just remember, Commissioner Cupid, by doing this, you know, there are people going to go in and they're going to take this out of context.
I just think, Mr. Chairman, that
Okay.
until you.
That's my concern, all right? Is that we're the ones that are asked to make the call. That's why I've opened this up, all right? I don't know how the other counties did it, but I made a commitment to you last week that if I was gonna have to declare this emergency, I would do it in conjunction with the board. And I think we're in the position now where we're the ones, the public is leaning on us to make the calls. We don't.
Okay,
That's my whole point, is that I don't believe we have the time to take this out and run it by our constituents. Dr. Emilia Marks made it very clear that this emergency has happened so fast that today's the day we have to do something. And
okay. So if there's any disagreement with any of the clauses, you're looking for commissioners to email that to you?
yes, exactly.
Okay,
And then do we
All right.
have to come back to vote?
No,
No, there's not a vote.
there is no
required.
vote. There is
Not
no
for the
vote.
declaration.
But I promise I will take all your input, I'll put together a draft, and I will send it to you. This is what I'm proposing to sign. And then there'll be probably some final tweaks there, and then I made it very clear that I'm waiting for the city of Marietta tonight to have their city council to make sure that we're as in line as much as possible with the cities. But every city, again, is its own unique entity, and they're gonna do what they're gonna do. This only applies to the unincorporated part of Cobb County, not to the
correct.
cities.
That's a good point.
Right.
Yeah. And then, okay, I've had a request from a couple of businesses, and I told one of them that I would make sure that I addressed it during this meeting because I thought that we would address some of these things a little bit more specifically.
Okay?
And one of the clauses for businesses it describes what essential businesses are.
Right.
I have a business that does distribute goods, and they are a family business and wanted to know, could they continue to fill orders for those goods at their distribution site?
That's a great question, and just go ahead and let me know what, give me some specifics there, and I'll see how I can incorporate that into the essential businesses on our list here, okay?
Okay, because I can certainly tell you that the goods that they provide are not an essential good, but them being able to distribute their product is something that would enable their business to continue to operate during this time, but again, just amongst their family members.
Well, you also notice, Commissioner Cupid, that people can do businesses from home, all right? And we
Yeah.
still provided people the opportunity for mail and shipping services to exist within the county. So you can do things without going out in the community.
Correct.
And then distribute them using the essential services that we allowed to exist in this town.
Mr. Chairman, even.
Yes,
for
but
the-
not this particular business. This particular business has a distribution site where their goods are that they do not keep at home. So what they're asking is, even if there's a shelter in place, could they still distribute it? And I'm looking at the internal draft of the Declaration of Emergency, and it does make provision under essential services
Right.
to permit well, it says delivery, and then it says warehouse distribution and fulfillment.
Sure.
Is this something, so this would fall under caveat?
Yeah, we've tried to make it general enough. It's kind of like the U.S. Constitution. You've given it some room there to bring in contingency we hadn't thought about.
Okay.
So,
Okay,
Chairman.
great. So I'll let the business know then that they can still operate under that provision. And then there was this is outside of the declaration of emergency, but also had a very large business within the district asked about additional support for businesses at this time, inclusive of deferral of tax payments or business licensing, permitting, and inspection fees. Is this the appropriate form for us to have that conversation, and if not, when?
no, that's a separate forum, and we've actually done a lot of those things already, Commissioner.
I know we've had some of them, but not all of them.
That's a
And I don't know
separate, that would not be declared, I haven't rolled that into here just yet.
I'm sorry, technically, I don't know what's going on, but I could hear you clearly before, but I can't hear you clearly.
Okay, it must be where my microphone is. Just go ahead and send me the questions you have here, and what I'll do is I'll get with the county attorney, and we'll see how that fits in the declaration, if that's an appropriate forum for that issue to go into the document.
And Chairman, just real briefly, paragraph 10 would be providing the county manager the ability to be able to suspend any law or code provision, strict performance of which wouldn't necessarily
Okay.
be required. So that would take into account those things on a case-by-case basis.
Okay, great.
Okay.
Thanks.
Right, and Mr. Chairman, an example, and Rob, actually, we worked on this yesterday. We currently have our building inspectors only going out to commercial sites or new construction, because there's no people involved. And so I had a lady call the office that Kim told me about that has been doing a renovation and had a new HVAC system that needed its final inspection. Well, we initially told her we couldn't come out and do it. Well, we can't expect somebody to shelter in place if they don't have a place to shelter. So one of the things that the county manager is allowed to do, and it's in our code, is we can get a signed letter from a professional engineer certifying that it was installed per code. Okay, or we can send out an inspector. So I think that, we have to acknowledge that there are some things that need to still go on to keep the county functioning. For example, land surveying. You can only do so much of it in the office, but you have to physically go out and survey the land. So, and I think, what the chairman has put in here, only thing that it closes is bars and restaurants. But it still allows them to do takeout.
So far.
So far, right. But I mean, so I think the point is that we're asking everybody to take, personal responsibility and to go out and limit these big gatherings. But I think that there are some services that just can only be done in person. And, Commissioner Cupid's comment, what I've read in the draft document, it does not prevent what she described from happening.
All right, Commissioner Cooper, you still have the floor?
Oh, okay. Just again, in the sake of closing, my support is for Dr. Memark's recommendation.
Okay,
However, I am in support of many of the caveats that were included under the draft declaration, and I will send those to you.
I appreciate it.
But my request would be for us to integrate her recommendation into the declaration
Okay, all right.
and to remove anything in conflict.
Okay, terrific, thank you.
You're
Commissioner
welcome.
Burrow.
Yeah, I just had some comments
Go
too,
ahead.
but
Sure.
I'll send them to you.
Okay,
Via email, but we have heard from a lot of folks, citizens, businesses, and even healthcare professionals as well. So I think we all have a lot of information here today, and I think it's helped in weighing with our decisions moving forward. And I was a germophobic before all this, so I'm 100 times worse now. And I'll be sheltered in place with my husband, who I'm driving crazy.
Can I ask Dr. Mimar one question,
sure,
please?
absolutely. Darn right.
And this is coming from reading this policy. I'm a little conflicted because
Okay.
under number 2, just so you can follow where I'm at.
Section 2, or,
Section 2.
okay,
We say a community gathering does not include the following or similar uses in its childcare. Can you elaborate on that? Because I know we're closing the parks because kids are going out and playing on the same equipment and then touching their faces and potentially, so childcare.
So I'm glad you brought that up, because when you look lower down in the document, it does clarify certain childcare entities, and that's up for discussion. I would love to see that we are able to minimize those the best that we possibly can. So there are some reports of healthcare workers that are having trouble finding childcare, and so that is a big issue. I don't have the answer for that, but like I said, we have 3 cases that are positive in daycares. So as best as we can get that down, I recommend that. So, but I understand it's difficult. So.
Well, and I think, to kind of go along with that, we should really emphasize that the daycares are being allowed to stay open primarily for healthcare workers to have a place to bring their children so that they can be available to take care of the sick people.
Yeah.
If you don't need it, don't take your child there.
Absolutely.
I mean, it's really, they're being left open for those folks that, both parents work and they need to work, to sustain the family and everything. But the reality is that, the daycare is, as the chairman said earlier, life is different right now. And if you don't need to go to daycare, you need to make sure that you keep your child at home.
I mean, I'll give you an example. Even one of my own who is, working on the front lines of this, was afraid to take her child to the daycare because she's the one that's doing the disease investigations, and I fully supported that. So she had to actually drive her children out of state and take them to a grandparent that's sheltering in place, and it's heartbreaking. But these are decisions that we have to do to make sure that we can keep our people healthy.
And then one last hot button is our transit. I know we've scaled back on our transit, our buses and stuff, but do we need to look at potentially scaling those down even more?
Yeah, it would make sure that you try to put some measures in place for that as well. I mean, if we have people sheltering in place, then hopefully that will cut that down dramatically. We have sent some guidance to the Cobb County Transit Authority to try to help with some of that, but definitely it needs to be looked at, because I know that is an essential service, but hopefully we can cut down on how many are using.
okay, thank you, Dr.
Can I
Moore.
ask for one final thing, because I get a whole lot of people.
Yeah.
No, I'm sorry, not you,
Okay.
Dr. Moore. There's a whole lot of people that want to know who Cassie is.
Oh,
So you got to come show your face, Cassie, because everybody wants to know who this mystery woman is that we keep talking about.
so
Hi.
give us your bio, Cassie, in 30 seconds.
Oh, goodness. I'm almost a 20-year employee here in Cobb County. I have dedicated my entire life to the goodness of the county and the goodness of the county and the well-being of others. And This is challenging for all of us, and for me especially, it's waters I've never navigated. If it were a tornado, I could wrap my arms around it. This is something that at this time can't. So I have the enormous responsibility of making sure that you all have the information needed and that we can make the right decisions. And that we can hopefully come out of this thing better and stronger than ever. It's going to be hard, and a lot of things a lot of unknowns that I've never seen before. But I couldn't be more proud of the team that I get the opportunity to work with. This county is full of so many good people on the levels of our volunteer programs and the community that help with the homeless and those that are less fortunate. And we just have so many resources available to us. There's no reason that we can't pull together, and this is what that time is. We have to stick together as a community. We have to support each other as a county, as a public safety team. Randy Crider's done amazing holding us all together in public safety, and I just hope that I can continue to make the decisions that I need to and follow through with our state and federal partners that are now going to be helping us get all the information we need to get through this.
And how long have you been the director of EMA?
I was a deputy director in 2012, and I've been the director since 2016. I was involved in the floods. That was my first assignment after I was in the Cobb County Police Department, so I'm law enforcement background. That's where my heart lies, in public safety. So I'm really thrilled that I have this opportunity, and I'm scared too. So I'm hoping that I can succeed and live up to that expectation, and I'm going to do everything I can to make sure we come out on the other side of this. I've had great partners with public health. John Hauser used to be one of our police chiefs, is there now. So I have a great working relationship with them on the preparedness side, and Dr. Meemark and I have been in constant contact. So I think together we're going to be in good shape. It's just going to take a little bit.
Well, and I just want to thank you and your team because you've done a wonderful job. And also, just so folks know that not only have you done a great job of standing up everything we saw with the flow chart, but we also have a web-based EOC
We do.
that allows you and your team to not have to physically be in the same place. So
Right.
not only are we advocating for the population to social distance, but your team and your EOC members are doing the same thing because of what you and Sharon Stanley and folks have put in place.
Yes.
So thank you.
Yes. Sharon and her team, the information services team, they've helped me. I was doing reports the old-fashioned way up until about 3 days ago, and they helped me get Adobe. I had no idea it's such a great product, but we're finding it's a learning curve for us. You know, if I have to spend 18 hours to produce what I'm supposed to produce, it's going to get done. But thankfully, there's people that can see there's a better way, and they are there for me, and they give me those tools that I need to succeed, and I'm thankful for that.
Well, thank you, Cassie, and all your team.
Thank you.
Okay, hearing nothing else, we're adjourned.